it's community health nursing, as I say. It's a combination of nursing and personal care, case management, coaching, training. So it's doing everything what's needed to support people in their home and to support people in a way that they can help themselves again. So sometimes the focus is more on the families, for example. Then you train the families how to handle the situation. Sometimes it's more case management. For example, people with ALS. You know ALS? That's so it's this disease where it's very progressive. Then we invite all the people who can contribute to the social network, for example, and who can also do some activities so that the social network of this patient will be as strong as possible. So building networks, coordinating activities when it's complicated, when sometimes we have daily contact with the physician, working together with the physiotherapists when mobility is a problem. So when you can improve mobility, then you should focus on improving mobility. So training programs, and also training the families, but also just doing the showers or doing the nursing procedures. So it's a very holistic way. So we don't say you should only focus on nursing activities. So we say nursing is the whole spectrum of activities which contributes to a better situation for the client. What we try to do in every country is not making the financial streams leading in what we do, but start with the problems of the patients and see how can we handle the financial streams. So in Holland we also had four or five money streams. So, and we said what we do with patients should not be depending on how we got paid for it. So, and sometimes we got paid, for example, less per hour, and it's not enough to cover the cost per client, but it's enough to cover the cost per team. So we said we have some higher tariffs and some lower, and the average is enough to cover everything. So the nurses shouldn't be busy with deciding what can I do and what can't I do. Yeah? Because in the other organizations that worked before 2006, all the time they have to think about what is this for product? Can I do this as a nurse, or do I ask a nurse assistant to do it? So and this led to a lot of frustration and fragmentation of care activities. So and a lot of people said, how is it possible to have this education level, this bachelor nursing level, to do everything? Because there are very simple things. If you look at the activities, it looks very simple. But that's not the most important thing what these nurses are doing. No, they need to see what the mobility of this patient is to be able to improve it. There are different ways. Sometimes it's the GP, the physician, who says, okay, this is getting worse and worse. So then he calls the team. So just have a very good relation with the physician. And says, can you visit this client, for this patient, and try to find out what's necessary to support him. So that's one way. Then another way is the hospitals. So we got a lot of people who are referred from hospitals and say, okay, we need, like we have some surgery, or we have a stoma, or we have another reason that we need support at home. That's the second. And the third one is the families themselves. So if patients themselves say, okay, we need support, we can't help ourselves anymore, or we have this progressive dementia or other things, then they can ask themselves. Then the nurse visits them, usually the same day, discuss with the patient and the family how the situation is. That okay, make some first idea about what's necessary. But usually it takes some weeks to get a good picture of the situation. So we said, don't focus too much only on this one moment, on this assessment. We say the continuity in person is very important. So we say this one nurse should be responsible for the whole process and following this patient, taking care of all the necessary activities and evaluating the situation. What we see is that people feel very supported in their roles. But my experience is that when people don't know what to expect, then everything what happens is unexpected and is also creating stress. So when you know what's going to happen, for example with ALS or dementia or with palliative care, when you talk about these things with the families and you say, okay, the coming months, the coming weeks, these things can happen, and how do you think about it? How can we handle it? What could we do? What can you do? Then it feels more as a situation you can handle together, and you can lower the stress by, and it's a way of case management, you can say, but also by training the family. If you say, okay, there are family members who want to participate but don't know how, then we say, okay, let's create a course that we train the family members in how to deal with practical consequences. So all the time try to attune to the situation. Try to find out where are they, what is the family, the social structure looks like. It's always different. So and that's so important that you have this process where you get to learn the situation from week to week. And then after a few weeks you see that what happened in the first assessment is quite different than what you see after a few weeks. Then people show themselves as they are. So for me it's very important that you get a connection, and that from out of this connection, based on trust, if people trust you, then they will tell about their real problems and they will say, okay, we see also solutions. So I'm not very fond of multidisciplinary teams. So what I see in a lot of countries is that when you put professionals from different backgrounds together, that they're very busy with each other. So the focus, if you don't have the focus on the client, and if you don't build the network of the different disciplines around the client, my assumption is that you have 80 to 90% of the situations are monodisciplinary. So you can handle with the generalist. And then you have 10% where you need multidisciplinary. So if you create multidisciplinary teams, then you create a lot of discussion just for 10%. So that's what we see in Holland now. We have the local communities have social teams, they call it social teams, and they put all kind of different people together. And these people, they don't feel it logic that they are working together. So, and then they got trouble, and then they need a manager, and then they get a manager above the manager. So, and one of the biggest complaints of the social teams, it's that they're not doing what they supposed to do. So I should be very careful with creating structures which are not based on the problems of clients. I think it's a very important question. I think you have to create sensitivity. So if you are sensitive to the environment, you will get the information when it's needed. So if you think about, what you see is that a lot of organizations are creating their control and planning cycle by saying, okay, then we are going to do this, then we're going to do that, then we're going to translate it into policy plans, year plans, and so on. And while doing this, you are creating a distance between the organization and the environment. So what we say is that if you listen to the environment, there's all these teams, they are very sensitive to the networks they're working in. So they get information and ideas about what they can do to be as connected as possible. So when these teams are writing experiences on the web, you can see if several teams are writing the same things, then perhaps it would be a trend, or it would be asked for attention also from me. So instead of telling people what to do, it's much more important to listen what people are telling you. And then if you say, okay, this has some strategic consequences, then you have to think about, okay, let's create a meeting. Then invite people. Say, okay, I hear this in different places. Let's have a meeting. And then I ask people, is there something I can contribute to that I need to discuss it with the ministry, and then say, okay, let's go with some people together to the ministry. So it's a quite other dynamic than usually you with the management team. You sit a few days, you define the new vision, then the strategy, then the policy, and I think that's we should do it differently. So. There are several international reports. So one of the Commonwealth Fund, this from KPMG, Ernst & Young are also translated in English. There is now a report from INSEAD from Paris. So all these international reports make that we are on the agenda in a lot of countries. So, and what we see is that if you look at the embassies or the ministries, they exchange ideas. So everybody's looking for new models of care, and so that's one way. There are a lot of conferences all over the world. So people like this, we are invited at conferences to tell about what we are doing, and then we have a lot of requests from separate organizations. So just organizations who are struggling with their structure or who want to be focusing on an innovation or whatever. So then we invite these people to come and visit us in Holland, and what we try to do is to build a network in the country where people of this country themselves try to find out how they can create something which is base for a start. So, and it's different in every country. So sometimes it starts with, like in Scotland, it started with the ministry. So I was invited by the ministry, and then the ministry decides to do 8 projects in Scotland. In England, it was the NHS. So the NHS asked us to, and then together with some organizations, we are trying to just transform existing organizations. In Germany, it was several organizations and also several individuals who were interested in this model. And then we said, try to sit together and try to think about how it could have a development in Germany. I think up till now, there have been, I think, around 10, 15 organizations who are interested, but at the same time are struggling with the payment system, for example. So what we try to do is, in most countries, to address the payment system. So then it's quite easy if we have contact on the Ministry of Health, and at the same time we say, okay, make it just create an environment where you can practice. So say make it very practical. Don't make it too big. Everybody can start just a small experiment with 4 people. That's not so difficult. Yeah. So and after that you can learn from this experiment, and then you can to use the experience for creating a bigger environment.